thing. So welcome everybody. So firstly, I'd just like to say a thank you for joining today, and a real special thank you to our local partners and leaders across Blackburn with Darwen who've embraced this campaign to create a real lasting impact for people living with long-term health conditions. We'd also like to express our gratitude to Sport England, who back the We Are Undefeatable campaign and the work of Together an Active Future through National Lottery funding. And this place-led campaign would not have been possible without their support and willingness, and also the commitment to this agenda with the partners in Blackburn with Darwen too. So I'm delighted to be joined today by Alison Whittaker-Stewart, who's the Physical Activity Campaigns Lead at Together an Active Future. We've got Charlotte Pickles, who is the Public Health Specialist at Blackburn with Darwen Council. We've got Barbara Langer, Evaluation Manager for We Are Undefeatable at Insight Angels, and one of our wonderful campaign storytellers, Zoe, all of whom you'll hear from very soon as we go through today's agenda. Now, to really set the scene, this campaign contributes to the strong evidence of fostering 3 of the conditions necessary for place-based approaches to address inequalities in physical activity, as was identified through the National Evaluation and Learning Partnership in relation to Sport England's Uniting the Movement strategy. So these key conditions include processes for identifying the barriers and enablers of physical activity, collaboration, and also relationship building as well, all of which we're going to explore more today as we go through our learning and impact. So swiftly moving on to today's agenda. So for those of you that might have joined us before, we've done webinars about our approach to this campaign previously, and you might have heard about the campaign through other forums. But today we're focusing on the impact and learning that we've really unearthed from the campaign and from the evaluation that our local partners, and also through Barbara's work, who's led on the evaluation of this and the report that we've produced. So this is what the agenda's looking like. We're going to have some lived experience to kick us off, which is what We're Undefeatable is all about. We're going to look at the local context, what the campaign looked like to set the scene, and then we're going to really delve into the impact and the learnings across residents in Blackburn with Darwen, the partners and the systems, even the impact on our campaign storytellers. And then what we're really keen to do is share our transferable learning for the work that we've done here. And we'll also have a quick look at what's next for We're Undefeatable in Blackburn with Darwen, but then also a wider campaign that's going to be rolled out across Lancashire soon. So lots to get through in an hour and 15 or an hour and 10 now, because I've spoke for 5 minutes. So firstly, we want to share the key context and the impact from this campaign. But I think one thing that's really clear is to say that there's so much more to unearth within the full report. We've got a wonderful case study from local partners, Deaf Village Northwest. We go into greater depth on our localization principles, how we've worked with national partners to leverage the campaign, and of course, all of the wonderful stories and supporting assets that you can still utilize from the campaign today. So please scan the QR code. We're also going to put a link into the chat as well, so you can download the full report. That's where you can, we're going to cover as much as we can, but we couldn't do it all today. Nope. And I guess our aim for today is just to share our experiences, our challenges, our best practice, the learnings that hopefully can then enable others who are working to support people to move more. There's been great interest in this campaign since it launched, and also since we've done the evaluation work, and hopefully our learnings can help be useful for others. But before we go into the nitty-gritty of the insights and learning, we wanted to start today by showing what We're Undefeatable is all about, and this campaign in Blackburn with Darwen, the lived experiences of people living with long-term health conditions and how they have found their way to move more. So I'm going to share one of our BWD campaign videos to give you a feel for what the place-led campaign is all about.
Peter, have you shared the video? I can't see it.
There we go. So hopefully everyone could see that or hear it there. But what we can do is share a link to Zoe's story and all of our campaign stories in the chat shortly. So we can get that over to you so you can take a look at. We have 16 campaign storytellers across Blackburn with Darwen, all with different health conditions from different backgrounds and doing different activities as well. So there's such a vast range of stories that can be utilised and that can be shared to inspire other people living with health conditions to be active. And to continue on that lived experience theme for today, we're going to start by introducing one of our campaign storytellers, Zoe, who has featured both in the national We Are Undefeatable campaign and also the Blackburn with Darwen campaign for a bit of a question and answer section before we head into the campaign evaluation findings. So, Zoe, are you there?
I am, thank you.
Lovely. And nice for us to bring our double act back together. We've been on radio together, podcast together, and I think we just want to say a big thank you for joining today and giving up your time.
My pleasure.
So I guess to begin, Zoe, you've been involved in both the national and the Blackburn with Darwen We're Undefeatable campaign. So I guess, and we've just heard how fantastic your story is, but why is it important for you to tell your story and to share that with others?
Yeah, sure. So I think, 4 years ago, I was only probably early 40s, mid to early 40s. As I being struck down by a stroke at such a young age surprised me. I think it surprised a lot of people that people from my age and a lot younger are impacted by stroke. And I think for me in particular, it was a very lonely journey in those early days, navigating something that you sort of perceive is something that impacts the older generations, and not really knowing who to reach out to, what support was out there for me, and also the communities that I could get involved with. So when I saw the opportunity to get involved with We Are Undefeatables, I think We Are Undefeatables in particular for me, it's there for everybody. It's there for all ages. You don't feel alone because there are people that you can relate to with it within the whole charity and We Are Undefeatables.
Fantastic. Thank you for sharing that. I know you've been quite passionate about raising awareness for young stroke survivors and changing the narrative on that, haven't you? And I think that's part of what we aim to do with campaigns like this, is to change the narrative and to change perceptions. So we know you've inspired many people. You've obviously been on TV through the national campaign, and you've inspired many people across the country. But what did it mean to you to be involved in a place-based campaign in inspiring people in your local area?
Well, I was born here in the Blackburn and Burnley locations. So for me to make a difference in my local area means a lot to me. If I can just help one person or a small community appreciate that, just the smallest of movement, whether that's going into a gym and doing some form of small physical movement or just doing something at home, the impact that it can have on your life positively, if I can help people be made more aware of that, for me, that's a key win for me. Because I felt very alone in the early days, but if I can help people feel like they don't need to be alone, and there are some great communities like We Are Undefeatables out there to support people like me feel like they can have a journey with physical movement involved, then absolutely that's why I wanted to be involved with this locally.
Fantastic. And just to build on that then, what was it like seeing the ads around Blackburn and from your perspective or from family and friends who you've seen?
It was quite comical actually. I'd go into, say, my local gym and I'd go, "Oh, I saw you today." And I was like, "I'm sure you didn't. I was at home all day working." And I know we saw you today. You're on the bus stop. And so people kept sort of speaking to me on a regular basis about the fact that they'd seen me, but not explaining that it was actually a poster that they'd seen in the middle of Blackburn, which was quite comical. But then they were spotted all over and they kept moving around. So I kept seeing myself in different locations sort of as the campaign went on. Yeah, lots of people kept coming up, which I thought, straight away people saw that and spoke to me about it. So it was just from those conversations, it was having real positive impact.
Yeah, it already starts to create a bit of a ripple effect. Even if it's with maybe your nearest and dearest, they might then talk about it and share it a little bit
Yeah.
wider. But that's interesting because we know other storytellers have said the same. So I guess, yeah, from the national campaign story, you were quite recently post-stroke, and it really focused on your sort of initial rehabilitation and the journey. You can see Zoe's image on the screen now, which was showcasing a lot of movements that you could do that were, I guess, prescribed by a physiotherapist for you
Yes.
to work with. But obviously, what we've seen a couple of years on within the Blackburn with Darwen story is that your journey's progressed significantly.
Yeah, hugely.
So why is it important to you to show others the different stages of your stroke and the journey that you've been on?
Sure. So I think small movements in the early days have actually paid off to larger movement and more physical activity now being a big part of my life. So back in the early days, just trying to put together a jigsaw puzzle or use like the bands that are in the picture that you can see right now, they were exhausting. But they played such a key part in building up my strength, building up my balance, just building up my overall confidence, because I could feel that utilizing movement was playing a really great part in my recovery. Where now, I spend much more time in the gym. I'm able to do much more in the gym. And I also find that if I don't go to the gym or I don't go for a walk, that I can see that I can sort of relapse slightly. So utilizing physical movement for me sort of prevents those small relapses happening. And if I keep going, I keep building my strength and improve my balance as I go.
Well, I'm sure everyone will agree. It's wonderful for us to see that journey. We've just had a question in the
Glad
chat
to
before I
see
move
that.
on to my next one. So it's a really good question as well. Were you active before having a stroke, Zoe?
I was very active before my stroke, and I think that was one of the hardest things for me when the stroke did happen. It was like, am I going to be able to go back to any form of physical activity? That in those initial stages, for me, I just thought that was never going to happen again. Yes, it has always played a big part in my life, and I had to start small and work back to where I am today. I'm not back to where I was. I'm hoping I'll get there one day. It's about being consistent, but yes, I was is the answer.
Great, thank you. And I guess that's the point that people's journeys start at different times, especially when people have a diagnosis or multiple diagnoses, for example. So the final question then, Zoe, you've talked a little bit about the sort of benefits that you felt and the wider benefits of being active on, I guess, your physical and mental and even social well-being. But are there any wider benefits that you've experienced from being involved in the campaign? We know that you've been asked to do different things and be in different places. So is there anything else that you've noticed?
I mean, it's massively built my confidence up, sort of since those early days. I think, but it's just allowed me to sort of get involved with so many different communities. I mean, I've sort of got involved with the radio and lots of different things over the last sort of 3 to 4 years. But yeah, I think the key thing for me has been it's just been confidence building and sort of managing my mental health. It's played a massive, massive part. And I think also knowing that I'm making a difference to others as well.
Amazing. Well, I'm going to say a big thank you at this stage,
Thank
Zoe, for
you.
sharing your story again. I'm sure everyone on the call can share some love for Zoe today for sharing her experience. And yeah, please stay with us. There might be questions that come up or might be questions that you have, Zoe, but a big thank you for your involvement today and for sharing, I guess, what all of this is all about and to really help us to set the scene. You're getting lots of love coming through, so thanks, everyone.
Thank you.
So next up, I'm going to hand over to my colleague, Charlotte Pickles, who's going to talk a little bit about the local context and how we're starting to set the scene about why the campaign come about in Blackburn with Darwen. So over to you, Charlotte.
Thanks, Pete. So I'm just going to give a bit of a brief background to Blackburn with Darwen. So why the campaign came to us, why it felt like a really important opportunity for us in Blackburn with Darwen. I work for the public health team in Blackburn, and obviously a lot of my work is around reducing health inequalities, and I specifically work around physical activity and health outcomes. So this was something that presented itself to me through a webinar, and it was something that we thought absolutely this can work for us. So Blackburn with Darwen is one of the most deprived areas in England. For those of you who aren't from this area, who don't know that, you can see a map on the right hand side of the slide here showing some of the highest levels of deprivation in some of our sort of central and eastern areas, so where the dark purple is. We do have some other more affluent areas in Blackburn with Darwen, particularly in the Darwen area, which is the lower green areas. But again, that sort of demonstrates some of the inequalities that we're presented with, and some of the challenges that we're presented with. We have, so the 2021 census found that we have a large number of residents who are living with a long-term health condition or an illness that limits their day-to-day activity, which is higher than the England average. And we also have a third of our economically inactive people are out of labour market due to long-term illness. So we know we've got issues around sort of long-term health conditions, and that impacting on people's ability to be economically active, which is an issue for us. And also coupled with that, we have some of the highest levels of physical inactivity in the country, so which obviously contributes to high rates of preventable disease. So we've got a bit of a double whammy happening, where we've got high levels of deprivation, lots of people who are not able to work because of their conditions, and also lots of physical inactivity. So it felt to us it was an opportunity to use physical activity as a tool to support people with their health outcomes, their mental health and well-being, and also ability to contribute to the workforce, and also to their communities. Thanks, Pete. So in Blackburn with Darwen, we have a strategy. Most local authorities will have one, which is around sort of healthy weight or healthy lifestyles, and ours is our Eat Well, Move More strategy. It's been around for a number of years, so it's very well connected. So it was something that was able to get quite a lot of exposure around the We Are Undefeatable campaign. We've got 5 core work streams underneath the strategy, and we really felt that the campaign would support the one around reducing health inequalities, so our targeted provision to reduce health inequalities, but also supporting our workforce, because we know that there are lots of people who are struggling to stay in work due to a health condition or are wanting to get back into work. And also our active environment. So a lot of this campaign was linking about what assets we have available to us across the borough in terms of outdoor space. So our green and blue spaces, and how do we encourage people to be more active in the communities that they're in without it having to be expensive or having to go into gyms. That's sometimes the case for some people, but we really wanted to think differently about how people could be active. So it fits really well within our strategy, and it's obviously our strategy is well embedded within our governance, so it was a really good place for us to get started with the campaign. Thanks. So we had some objectives and principles that we set out initially. First of all, obviously, I did a lot of going around to different groups across Blackburn with Darwen, lots of partnership meetings, lots of sort of high-level strategy meetings to talk about We Are Undefeatable and get it socialised for people to understand what it was and why we're trying to go with that. And these were really what underpinned this piece of work for us here. So we wanted to reach people who experience widening health inequalities due to the health condition. We wanted to inspire people to be as physically active as they could be, to support the management of long-term conditions and also to prevent them. So we've done quite a lot of work around prevention as well. So it's really about raising awareness about the importance of physical activity in different areas, different sectors of our communities, and across our healthcare professionals as well, to try and make sure that we're all driving the same messages around how important it is to be physically active. Our principles were really around working with local people. We wanted to make this as compelling as possible. So we wanted to make sure that the storytellers, the 16 of them that Pete just talked about, are representative of our different communities, our different demographics, different ethnicities, different ages within Blackburn with Darwen. And we wanted to make sure that it was data driven. So we were looking at our ward level data around specific health conditions and where they were most prevalent in different communities, and to make sure that we were linking those storytellers to those particular areas. So people felt like, oh, this is talking to me. I feel like this is about my story, and this makes me want to link him with what the campaign is trying to get across. We needed to make sure we had full stakeholder engagement, so we did a huge amount of work with all of our core partners, with our local community providers, but also some of our strategic leads. And we wanted to work with our healthcare professionals, so work with our PCNs, to make sure that they were linked in with what we were trying to do as well. So lots and lots of linking going on, lots of signposting. We're very lucky in Blackburn with Darwen. We've got our health and wellbeing service who act as a one-stop shop for people to be able to be signposted into them. They can do an onward referral, and that's what I'll speak later about, what's next for us in Blackburn with Darwen. And that's really been part of this, has been really bringing people together, working collaboration, getting behind something, finding a campaign which is going to help us to sort of pin that to, and then taking it to the next level. And I'll hand it over to Alison, who is going to talk through much more around the sort of the data-driven part of this and how we start to shape this campaign for us locally.
Thank you, Charlotte. So initially we looked at JSNA data to gather a picture of Blackburn with Darwen and the impact of all the different long-term health conditions that We Are Undefeatable charity partners reflect. And then we did a much deeper dive using public health data from Blackburn with Darwen public health team. What we ended up with was a huge big colour-coded spreadsheet. There's lots of different information on, and we needed to drill that down and make sense of that. We were very fortunate to have a great connection with the Chief Executive of Health Watch in Blackburn with Darwen, who provided us with ward profiles for each different ward in Blackburn. So that, combined with the quantitative data from the public health team, we matched them together with the insight from different organisations working in the borough. We were able to identify actually which storytellers would resonate in which different areas and choose our ad placements appropriately. And ultimately that meant the cost of delivering the campaign was much lower because it was resonating with the correct audience and the impact was much higher. If you don't have a public health team in your council, then you could contact NHS Business Intelligence or use Fingertips, which I'll post a link in the chat for. So what did the campaign look like? It was a multi-channel campaign, and we were very keen to do this to avoid any digital exclusion. So all the stories are on the Blackburn with Darwen public health website, which there is a link in the chat already to. They're all on there, and yeah, it's a great resource. From there, we shared the campaign on social media through the council. We're very fortunate to have 3 different channels at our disposal. So the actual council website, the Refresh, the local wellbeing service, and Blackburn with Darwen Leisure providers as well. We also encouraged our partners to share the content as much as we possibly could, and you'll see that the content we've created isn't branded, so that it is easily able to be shared across all channels, and you are able to utilise that content that we've created as well. It's not just for partners in Blackburn with Darwen. We also did a lot of out-of-home advertisements, so we had some large screens in front of the town hall, major road junctions. We utilised totem screens in the bus and railway areas. We used bus shelters as well. And what was really interesting was we had hundreds of bus shelters across the borough to choose from, but how did we choose them? Well, again, we used local insights to do that. We looked at our priority areas in Blackburn with Darwen. As Charlotte's mentioned, not all the wards in Blackburn with Darwen were priority areas in terms of long-term health conditions. So we prioritised, we RAG rated the different wards and spent more advertising in the areas where we needed to reach more. So not every storyteller was seen in every ward, not as many were seen in all areas. So it was very, very strategic and targeted. We also utilised printed publications. The One Voice magazine is a brilliant resource for us. One Voice is a Blackburn-based charity. It produces a quarterly magazine that's delivered to 14,000 households. And yeah, they were amazing. The insight that they also shared with me is, Alison, can we feature Zoe's story in this next magazine? Because there's quite a few younger members of our younger of our population, they're experiencing strokes, but it's not really talked about. And I think Zoe's story would really help. So as you can see, Zoe's story is featured in there along with Usman as well. Lancashire Telegraph, our local newspaper, were really great in sharing some of the stories as well. And posters, we professionally printed 8 of the 16 storyteller posters. We couldn't print them all, but we focused on the conditions which are most prevalent in Blackburn with Darwen. They were shared in all the council spaces, the family hubs, the libraries, the leisure centres, and they were hand delivered to all the GP surgeries. Initially, we had made all the posters downloadable on the website, but after tracking and monitoring, we realised they weren't being downloaded quite as much as we want. The printed posters, however, they were everywhere, so well worth spending on print. So these are our storytellers. As we mentioned, we've got 16 different storytellers, all with a range of conditions, all doing different activities. One of our learnings and key transferable learnings, which I'll touch on now, is if your area doesn't have the budget to do a campaign as big as this, then focus on what the long-term health conditions that are most prevalent in your area, going back and using that public health data. So I could spend all day talking about the impact of every single storyteller, because the impact has been huge, but we've just chosen to focus on a few ways some of the stories have really made an impact. So I'll go to Sima first, and I'm delighted Sima, moving to my own beat, it's actually joined us on this call, so hello Sima. Sima, we've learnt so much from Sima. She's really helped shape this campaign, and she's been brilliant in the fact that she's shared the assets through her personal channels, but also through SAS Rights, a charity that she's involved with. She's come onto the radio to speak with us, and her story's been shared in the Lancashire Telegraph. And she's also supporting Breast Cancer Now, one of the We Are Undefeatable charity partners, in helping them develop future campaigns. Glyn, he attends walking football at Blackburn Rovers. Through his story, we've collaborated with the English Football League, which I'm pleased to say they're on this meeting as well. So hello and thank you. And his story was shared kind of on a massive scale to showcase the role of physical activity for people with dementia and Alzheimer's on World Alzheimer's Day. So his story has had a huge impact. Then we've got Bob on his electric bike at the bottom. Blackburn Rovers were fundamental in this campaign. They actually reshot Bob's story with the stadium in the background and shared that across all their channels. And the impact of that was huge, because lots of people who were really looked at the story just because it had the stadium in the background and there was a football story there, then read our physical activity story. So that was amazing as well. And then we've got Sima, another lady called Sima. She's visually impaired, which isn't one of the We Are Undefeatable long-term health conditions, but the symptoms and some of the barriers that she's overcome are very similar. I'd like to add from Sima's point of view, because of her visual impairment, as with Ralph, one of our other storytellers, we connected with RNIB, who then allowed us to share their stories across their network. So the impact was much greater by making our comms inclusive. They also had audio-visual videos too. So yeah, the exposure from all the different stories is different, but together it's absolutely amazing. I'll now hand over to Barbara Langer, who is the Insights and Evaluation Manager for the We Are Undefeatable campaign, who's here to say what impact this campaign had on our residents, partners and the borough. Thank you.
Thanks so much, Alison. So yes, I'm going to walk you through what we've learned about the impact of the campaign in Blackburn with Darwen based on learnings drawn from multiple sources. So my job actually on this occasion was not to design the evaluation, but to interpret the information that was captured in various forms and write the report on it. So we'll first look at residents, and then we'll come on to describe the impact on local partners and systems and on the local storytellers themselves. So firstly, in terms of residents, the key mechanisms for looking at the impact on residents were a survey, digital reach metrics, and qualitative interviews and conversations. It's important to just acknowledge that the number of responses on the survey was relatively low. So while we do report on it, that is a slight limitation. It makes the qualitative feedback really important in the mix in terms of considering impact. But we looked at three key areas. Firstly, reach, so how many people in the borough came across the campaign. Secondly, inspiration, did they relate to the messaging and did it inspire them? And finally, were they prompted to actually take steps towards becoming physically active as a result? So just going through those areas. Firstly, in terms of reach, 66% of those who responded to the survey recalled at least one of the locally used campaign assets, which is a good level of recall, particularly in the absence of TV kind of backing it up. And just for comparison, the national campaign typically achieves 40 to 50% recall nationwide. So while we do have to caveat that low sample size, the result is indicatively a very strong one. And then just looking at the media individually, residents were most likely to say they'd seen social media executions, but there was also quite a good level of recall comparatively across the billboards and screens, which were shown across town, and posters in the GP practices and community settings, so 49% and 40% respectively. And a quarter of respondents said that they'd actually directly accessed the website that had been created, which Alison mentioned, for the local campaign, which features that not just the local storytellers and their stories, but the signposting to the local physical activity provision. In terms of digital delivery and the metrics we've got on that, although it's relatively difficult to establish what good looks like numerically for a campaign like this, the team was really delighted to see paid advertising reach of over 1.4 million, significantly increased traffic to the Blackburn with Darwen Active Living website pages, and also strong video completion rates. Viewers were watching a lot of each video, indicating strong engagement with the content. And we can hypothesize that data-driven approach to targeting the content was what helped to drive the engagement and ensure that the media spend was more efficiently deployed. With so many storytellers involved, the team was also able to diagnose which stories were resonating the most and further leverage that content. So just turning to impact in terms of inspiration and action among residents as a result of the campaign. While again, we do acknowledge the relatively small sample size, there were some really strong numbers in terms of message takeout and the proportion who then took action. So almost everyone, 85%, took out the message that people with health conditions can be active. That seems to also have translated into action for a number of them. 45% of the total sample claimed to have taken some kind of action as a result of exposure to the campaign, which does compare really favourably to national levels. And it was very much a mix of direct action in terms of restarting some form of physical activity, but it was also about the consideration and the indirect action and the gathering of information about local physical activity options that people were also reporting. So the indications we have are that the localised messages have resonated. And I'll now just share a few learnings on the impact that's been observed among local partners and systems. So this again was explored both through a survey among stakeholders and also qualitatively through individual interviews and ripple effect mapping. And I think that for a local project like this, we would advocate for ripple effect mapping as a tool to capture learning from multiple perspectives, and it certainly was very valuable. So we'll look at the impact by the different types of organisations involved that are highlighted here one by one. But firstly, just to touch on the overall local collaboration, there was a really strong sense in all of the feedback that passionate local leadership and engagement had really fueled a productive partnership across the borough. So in the qualitative feedback, many stakeholders praised the alignment around the shared priority of promoting physical activity, and they were also really enthused by the opportunity to reflect local people and contexts within the campaign. So essentially what the campaign did was it provided a great starting point in terms of the messaging and bringing everyone together and acting as a bit of a catalyst. And then it was the passionate leadership that took that forward and resulted in the local action and engagement among many different players locally. And just a couple of stats from the stakeholder survey that reinforce this. 86% agreed that the campaign provided an aligned physical activity message. 81% that the campaign supported local organisations working with people with long-term health conditions, and 73% believed it reflected local needs and demographics. So the campaign was very much a vehicle for local alignment, but it did also need that strong leadership as well to foster the collaboration locally. The key factor in the initiation of the campaign, as has been shared already, was the engagement of the public health team in its data within the council. And through the information we captured, we learnt that use of public health data in that kind of way hadn't necessarily been standard practice always before, but it was particularly valuable for reasons that have already been touched on in terms of informing campaign targeting, ensuring relevance, improving efficiency as well. And I'm aware that that's also something that's resonated with other councils already who are keen to leverage their data in a similar way. It just really makes a lot of sense. Feedback from the information sources that I reviewed also highlighted that visibility of the campaign within the council itself fostered a lot of helpful connections across different teams. And one of the factors in that was the comorbidity stories, which highlight links between, for example, physical and mental health challenges. So, for example, reinforcing the importance of embedding physical activity into wellbeing support for those living with depression and anxiety, for example. In terms of the local physical activity sector, we've got evidence that has emerged through the stakeholder interviews of some increased demand for some services. So, for example, SAS Rights, whose founder is on the call, Sima, is a local community organisation offering weekly activity sessions and various other things as well. And they were featured in the local campaign. So Sima, the founder, was one of the local storytellers, has reported a significant impact on demand for physical activity services, but interestingly, not only those of SAS Rights, but also of other local providers. And this is particularly noticed among local Pakistani women who are engaging with those services. Another example from the interviews was an increase in the number of walking football participants attending sessions run by Blackburn Community Trust. And that's another one of the local physical activity services that's signposted within the campaign. And not only did they see a direct increase in participation, but they had a number of fresh inquiries from, for example, a local care home and over 50s community group. So certainly some evidence in the qualitative work that the signposting from the campaign did result in more people taking advantage of local services, so that claimed action stat we saw earlier in the surveys is actually real action as well. But stimulation of the physical activity sector hasn't just been at a local level. There's also been examples of connections created with national sports bodies as a direct result of the Blackburn with Darwen campaign. And I believe that's something that wasn't necessarily expected or anticipated, but it's nice to see the ripple effects working in the different directions. And it seems to have been very much driven by the storytellers' unique profiles and the ways in which they like to get active as well. So their challenges, their conditions, but also their preferences. So, for example, storyteller Bob has a really moving tale to tell about getting back into cycling following his heart surgery, and that captured the attention of British cycling. But as well as British cycling, connections have also been forged with the Canal and River Trust, the National This Girl Can campaign, and others. And I know that the National We Are Undefeatable team has always been really keen to support and amplify any connections like that. Turning now to findings in relation to the healthcare system, I think there was recognition from the start of the importance of engaging the healthcare system, the role that healthcare professionals can play in promoting physical activity, and how it would be important to work together. And in Blackburn with Darwen, a relationship has been established with the local primary care networks as a sort of key pivotal point. And that way the campaign and the physical activity agenda could be regularly discussed with the right people. And feedback has been that the PCNs have been really supportive, but in the evaluation it was also acknowledged that that relationship has taken quite a bit of time to build, and that fostering it would need to be an ongoing focus. But what did seem to help in Blackburn with Darwen was approaching PCNs with really tangible and specific asks and things like ready to use resources. For example, hand delivering posters to local GP surgeries to be immediately displayed in waiting areas, just making it as easy as possible. So although the relationship with the PCNs will be an ongoing focus, it does seem as though progress has been made, identifying productive ways to engage. And some of that has actually been played back to national healthcare contexts, such as the NHS Confed Expo. So hopefully that's also going to be inspiring healthcare system engagement elsewhere as well. Finally, just in terms of the charity sector, there have been many ripple effects in this context, because so many charities have appreciated the opportunity to harness the high quality and free for them content. So we've seen a lot of content amplification on social media, other channels such as newsletters, not only among campaign partner charities, but also among other charities, smaller ones, more local ones as well. So it's obviously great to see the materials being leveraged in that kind of way, extending the reach and the utility of the campaign nationally and locally. And one of the factors was that because materials were not explicitly branded Blackburn with Darwen, it actually made it easier for any organisation to share them, to position them correctly for their own audiences. There's just a handful of examples shown here, but British Heart Foundation, Breast Cancer Now, and Mind, but I know that there were also many more. And just finally, one of the areas we wanted to highlight was the impact of the campaign on the local storytellers themselves. So the storytellers were generally just immensely proud to feature in the campaign. They fully bought into its purpose. It felt like they talked about themselves being privileged to be part of it. And what that meant was they were sometimes really prepared to go the extra mile, it seemed, to influence their local communities in a variety of different ways, formally and informally, and to just really internalise the campaign mission. And some lovely quotes here to bring that to life. For example, on the left-hand side here, it meant everything to me. It's great to be heard and also to make people aware of what my illness is. My kids are so proud to see me around. And a sense of community was also created almost within the storyteller group itself, which many of them found very affirming and validating, and helped to spur them on, I think, and reinforce their commitment even further. So one of the storytellers here on the right says, "I feel valued as a storyteller and finally feel understood." And another said, "We can feel alone sometimes. This campaign has showed me that I'm not." So it's just a really potent reminder, I think, of the power of local connections and kinship, and how a local campaign can harness that for the good of all. A few storyteller reflections in terms of the impact as seen by them of the local campaign. A celebration event was actually held where storytellers talked about this, and many believe that they had inspired others locally to become active based on the stories they'd shared, and they're very proud of that. So they were proud to really be personally challenging the narrative around traditional exercise and who it's for, the fact that small steps do count. So yeah, just one of the quotes here, letting people know that you can do things even if it's a little bit at a time. One little step makes a big difference. And they also reflected towards the end on a genuine sense of momentum ongoing around the campaign in Blackburn with Darwen, and ultimately they felt the campaign was important enough to be continued, and I believe most are wanting to stay involved and continue to contribute to this work moving forward. So that's all from me. I will hand back over to Peter now to gather some reflections from you all.
Thank you, Barbara. What I'm going to do is hold on some reflections and questions till the end, and I'm going to talk through our top transferable learnings for place-led We Are Undefeatable campaigns, or I guess this applies to other physical activity campaigns too. And I guess what we really want to do at this section is share the challenges and the lessons learned, and also then what this could mean if you're keen to do your own campaign work or your own storytelling work, and how you can take that away and learn from some of the challenges, but also hopefully some of the best practice that we've experienced too. So I think some of this has been mentioned throughout, but I think one of the things that came through is the complexity of coordinating national and local. And this is just a very logistical one. It's all around, actually, there can be some very practical problems in coordinating diaries, getting to and from different parts of Blackburn with Darwen to share the campaign and to connect with different networks. We've been in online meetings, we've done in-person sessions, and really tried to socialise the campaign as best we can. But I think that's something that people should factor in, because it can be a potential consequence into the planning that you may want to take if you're rolling out a campaign, is sort of how often and the regularity of bringing people together to plan and execute the campaign. The importance of dedicated local leadership. I'm going to throw my hands out at this stage for both Alison and Charlotte Pickle's time in really flying the flag in Blackburn with Darwen, and being key instigators with the time and the connections to engage with local partners. But it never stops. We can always do more engagement, and the time that they have dedicated to this and to working on the campaign, as well as other parts of their full-time jobs, has been huge. And I think that's a key learning for us to share with others, is that it does take dedicated resource and time to really reach the impact and to reach and make those connections across the system with a campaign. So that's certainly one that we would share to take away, and probably one of the most important learnings that we have. We've touched upon this, and it'll be no surprise that it takes time to engage with the healthcare system, but we've been really lucky in Blackburn with Darwen that the public health team and the wider voluntary community sector have really supported us in getting into particular meetings, getting our foot in the door to share the campaign and to bring the assets to people so that they have a call to action, that they can adequately utilise the campaign. Locally, with local partners, it goes beyond buy-in. It's not just about, here's a campaign, go away and use the assets. It's about what it means for those stakeholders, how they can utilise it in a way that meets their own aims, their own needs. And I think that that's a really important part, is that it took a little bit of time to generate that ownership amongst partners. But I think actually sort of towards the end of the initial campaign period, we had a ripple effects mapping session, and that's where the ownership and the buy-in really started to come in. And that's what's led to what Charlotte's going to cover shortly in terms of the next steps and all of the great work that's carrying on in Blackburn with Darwen now. Measuring impact over time. I think it's quite clear just in general that we could have put more to it, or more budget in our evaluation approach in general. But when you have a budget to deliver an integrated campaign across a large town and area like Blackburn with Darwen, we try to do as much as we can with the limited resource that we had. We did a lot of stakeholder interviews, surveys that we created ourselves in-house, and then obviously had the digital campaign metrics through our design agency. But it's important to do this we did it retrospectively and look back on the campaign, but one key learning would be to also try and get a baseline and then post campaign, so you can really compare the differences pre and post. So the next one is considerations for the use of video. We were quite video led with this campaign, and it's something that we have done as a national campaign. And as you've seen with Zoe's story, it's so compelling and so impactful. But it is something that costs a little bit more. So when I've been having conversations with other areas who are keen to do their own physical activity campaigns, it's something that we've been sharing in terms of video costs a little bit more. You can do it sometimes with a photographer, which will cost a little bit less for if you're doing like an image only campaign that we know can be just as impactful. But at the same time, there's things that we didn't realise across Blackburn with Darwen, where we thought the videos were going to be like in GP practices, but actually only, I think it was about 20-30% of the GP practices had the ability to play video on their surgery screens. So we learned things like that along the way, and then adapted and created new resources that could be a bit more static to sit on those screens. And Alison mentioned this earlier, but campaign delivery on a smaller budget, there's so many different things that you can do to leverage a campaign like this on a similar or a smaller budget, like changing from video to being photo led, focusing on the most prevalent health conditions. You don't need 16 storytellers. You could just focus on the top 3 or 4 conditions within your within your area and the priorities of your public health initiatives locally. You can identify the specific target audience and their preferred social media platforms, and then create content just for that. Sima, who's joined us on the call, shared so much information about how a reel and TikTok would resonate better with the communities that she works with and engages with. And then we went away and reacted to that and actually created that content so Sima could share that. And this is all learning that happens naturally through place-led working, because you start off with ideas of how this may work, but actually the feedback from local partners and also storytellers helps you to then shape and assess it even more. And of course, if there's no budget at all, we do have our national campaign assets, where there's lots in there. You can create your own stories. There's lots of resources and tools that you can utilize as well. And we're always keen to work with people on how to leverage that and how to utilize those assets. So I'm going to hand over now to Charlotte Pickles, who's going to talk a little bit about what's next for We Are Undefeatable in Blackburn with Darwen. Thanks, Charlotte.
Thanks, Pete. Thanks for that. So this is very much about the next steps and where we're going to go. We absolutely didn't want this to be a campaign that came and then just disappeared. It was really important for us that this was an ongoing piece of work and making sure that it was embedded within our partnerships. So that was really important to us. One of the things that we have done is we've recently re-signed our commitment to the local authority healthy weight declaration. For those of you it's basically a set of commitments that we make as a local authority to supporting healthy weight across all our residents, and within that we're able to agree a set of local priorities, and one of the ones that we've put in there is around We Are Undefeatable, which is really important because it's signed off by the Chief Exec of the Council, and it's got a really good kind of it's up there in terms of high on the agenda. So we will keep ourselves accountable to that over the next 5 years, which is really important. We also have a really important network in Blackburn with Darwen, which is our active BWD network, which is led by our health and wellbeing service with all of our community providers, and we've very much embedded this within that network, making sure that all of those partners and those providers of physical activity are aware of the assets that are available and can continue to use the We Are Undefeatable resources. So that's been really important as well. We've also, I know we've touched a little bit about our work with our sort of more clinical colleagues, and we've worked really hard on our relationship with our primary care networks and neighbourhoods, and one of the things that we are doing is we're providing the physical activity clinical champions training. I know there's a question in the chat around kind of how are we measuring how people are talking to people about physical activity to support conditions, and that's part of the next step really in terms of building that relationship with our clinical colleagues, so that we can really try and encourage people to utilise the opportunities they have to bring physical activity into some of those really important conversations about improving health outcomes and quality of life. Thanks, Pete. And then a few other things. We're working with our different communications teams across the council and ICB. So we're working collectively. We have a meeting that takes place where we look at a sort of a shared calendar. We're looking at local and national awareness days to make sure that the We Are Undefeatable campaign is linked into that. And all of the many different stories that have been told through our 16 storytellers, being able to really resonate across different, so whether it's around mental health and wellbeing, whether it's around Alzheimer's and dementia, we're really linking into those days. And so it gives us a whole 12-month kind of opportunity to keep utilising some of those stories. They're not just going to disappear. They're very much things that we can keep pulling on as time goes on. We also continue to work with our storytellers. I know we've talked quite a little bit about them throughout the session today. I've got some of the storytellers on the call today. They are the most important people in all of this, because they're the ones that are encouraging other people to think, actually, yeah, I can be more active. And ultimately, that as a public health professional, that's what I'm aiming to do, is to try and ensure that people can be as active as they can be with the conditions that they have. So we're very much wanting to continue with that work, and really appreciate our storytellers, and want to look at how we develop sort of more peer support around that and more storytellers as time goes on. And one of the things that we've done to do that is that we've prioritised, well, we've set aside a piece of funding with our public health grant funding to enable some of our local physical activity providers to really think about new and innovative, I can't say the word, innovative ways to encourage people to be more active locally when living with a long-term health condition. And again, it's about thinking about those areas that, you know, how do we reduce barriers to being active? How do we make things more accessible? How do we work with people in different ways to enable them to be active in ways that they may not have even thought was, oh, well, that doesn't count. Of course it counts. Walking, you know, getting out and having a walk with your neighbour counts as being active. Or any other sort of strength and balance sort of activities that can take place in the home. So we're really trying to kind of support around this sort of collaborative approach, working with our providers and making sure that we've got that in place so people can access it. And obviously that'll be through our health and wellbeing service, who sort of lead and manage some of that work. So that's a lot of the stuff that's happening for us. We're really excited about the project going forward. We feel like there's so much mileage in it, which I never knew in a million years that when we first came across this, it would get to where it is and it would get the amount of attention it's had. But we're really pleased about that. And we're just really conscious that we want to really bring it back into what can it mean for us locally, and how do we encourage people to be more active, that call to action. So I'm going to hand over to Alison. She's going to talk about another initiative that's been taking place, looking at kind of a more Lancashire-wide campaign around heart conditions in particular, which has kind of led on from this work in Blackburn with Darwen. Thank you.
Thank you, Charlotte. And this campaign, Healthy Hearts campaign, is on a Lancashire footprint. And it's led from the success of the We Are Undefeatable in Blackburn with Darwen campaign. We can't do it across all districts in Lancashire. That just wouldn't be feasible for the budget and capacity we've got. But we, again, have used public health data, and we've enlisted the support of the British Heart Foundation as well to provide us with additional data, specifically around heart conditions, to identify those priority districts in Lancashire. And as you can see, I hope you can read the little table, we've chosen 8. We are looking, well, we have got a storyteller for each of the areas. This campaign isn't going to include a video. It's going to be photo led, just from a budget point of view. And yeah, it's going to be very similar. We're going to apply lots of the learning from the Blackburn with Darwen campaign to this campaign. It is going to be similar, but it is going to be different as well. We're looking at working with a whole new range of partners, and hopefully we'll be able to share our learning and evaluation with you later on in the year.
Thanks, Alison. That's great, and I think a testament to the ripple effects that happen and keep happening from this collaborative work in in Blackburn with Darwen, now across a wider Lancashire footprint. And we're going to come to questions in a second. There's just one that sort of relates to that Jemima's put in there about what other areas have done similar to Blackburn. So I think this is a really good example of where we're taking a slightly different approach based on Lancashire County Council's needs and the priority conditions, focusing more on heart health, but there will be some storytellers living with multiple conditions in this campaign. But I guess just in general, and there might be people on this call who've actually reached out to us off the back of hearing about this campaign or seeing the report in recent weeks that was launched probably just 3 or 4 weeks ago now, is that there's been lots of interest of people wanting to do something similar, and we've been having ad hoc conversations about that or supporting different places through the learning that we have. And I think one thing that's really clear is that we're not saying this is the best way to do it. We are just trying to be quite open and honest on what we found in Blackburn with Darwen, what worked, and maybe some of the challenges that we faced that then can help others to do the same, whether they have more, similar, or a lower budget. So I guess watch this space. We've had some interesting conversations with different places that they've started to happen, and hopefully it's something that they may consider to take on, because the more we can support people with long-term health conditions across different places where there's the need for that, or the greatest need for that in communities and neighbourhoods, then hopefully we're on the right track to reducing the inequalities that people will be facing. So that does bring us to questions. So thank you. And we know that's been quite a heavy hour. Hopefully there's been lots for you to take in. We've seen some questions come into the chat already. We're going to stop the recording now and then open up to questions, really, if anyone has any. I think we might have missed one in the chat, again from Jemima, so thank you. And then we can go to the floor, really. You can either pop them in the chat, or if you want to raise a hand, and we'll try and come to you. Jemima said, "Dear